Hello, I am Dr. Sudarshan Pandit. I am consultant hematologist, hemato-oncologist and bone marrow transplant physician. I am currently working as a senior hematologist, hemato-oncologist and bone marrow transplant physician in Cancer Center of America, Nashik. Generally, autologous stem cell transplant we will do in specific conditions like multiple myeloma and in case of relapse refractory lymphomas. So primarily in these two conditions we will do autologous stem cell transplant, multiple myeloma and relapse refractory lymphomas. For autologous stem cell transplant, what we will do first, it is done mainly in multiple myeloma and lymphomas. So first thing is we have to control the disease. So the disease should be in absolutely control. So if we document that the disease is in control, then what we will do, we will give some kind of chemotherapy to the patient, and after that, first thing is that we have to remove the stem cell from the patient. So how we will remove the stem cell? We will give some injection to the patient, and the stem cell which are hidden in the bone marrow will come out in the peripheral blood, and this peripheral blood stem cell we will collect and store in a particular temperature. After that, we will do conditioning chemotherapy to the patient. So this conditioning chemotherapy will wash out the every possible abnormal cells from the body, and after that, to rescue from these cells, from this chemotherapy, we will give that collected stem cells which are normal, and these collected stem cell will infuse to the patient, and this stem cell will automatically functions and rescue the patient. So this is a type of autologous stem cell transplant. Benefits of autologous transplant: generally what happens, as it is a patient's own stem cell, so there are less chances of graft versus host disease. The GVHD chances are very low. Again, it is less risky transplant, so again there are less chances of infection, again less chances of bleeding. So GVHD is low, infection rate is low, complication rates are low. So it is in a way it is a good kind of transplant, but again it depends upon the indication for doing autologous stem cell transplant.